Giardia, the common parasite.
Giardia, most popularly known as beaver fever, is a zoonotic parasitic disease caused by the flagellant protozoan Giardia Lamblia. The Giardia organism inhabits the digestive tract of a wide variety of domestic and wild animal species, as well as humans. It is the most common pathologic parasitic infection in humans worldwide. In 2013, there are about 280 million people worldwide with Giardia. A zoonotic disease is a disease that can be spread from animals to humans, such as rabies or anthrax. Giardia is spread by swallowing Giardia picked up from surfaces such as bathroom handles, changing tables, diaper pails, or toys that contain feces from an infected person or animal, drinking water or ice made from water sources where Giardia may live. For example, untreated or improperly treated water from lakes, streams, or wells. Swallowing water while swimming or playing in water where Giardia may live, especially in lakes, rivers, springs, and ponds. Eating uncooked food that may contain Giardia organisms. Having contact with someone who is ill with Giardia, and traveling to countries where Giardia is common. Anything that comes into contact with feces from infected humans or animals can become contaminated with the Giardia parasite. People who become infected with Giardia when they swallow the parasite, it is not possible to become infected through contact with the blood. In prevention and control of the Giardia virus, there are 5 main ways one can prevent Giardia. Practice good hygiene, which includes washing hands and properly preparing food. Avoid water drinking and recreationally that may be contaminated. Avoid eating food that may be contaminated. Prevent contact and contamination with feces. And clean up after ill people and pets. The warning signs of Giardia are stool which may contain blood, stool that may contain pus or mucus, diarrhea that may persist for longer than 2 weeks, a fever that is over 102 degrees Fahrenheit, or a fever that is over 100 degrees in infants, pain during urination, worsening abdominal pain, repeated vomiting, unresponsiveness, confusion, fainting, and urinating less than 3 times per day. If one experiences these symptoms, one may be infected with Giardia, and it is highly advised that they immediately seek medical attention. Symptoms vary from non to severe diarrhea with poor absorption of nutrients. It can result in weakness, loss of appetite, stomach cramps, vomiting, bloating, excessive gas. Symptoms typically develop in 9 to 15 days after exposure, but may occur as early as 1 day after exposure. Symptoms are caused by Giardia organisms infecting the cells and blocking nutrient absorption. Several drugs can be used to treat Giardia infection. However, some of the more commonly used drugs may not routinely be available in the United States. Different factors may shape how effective a drug regime will be, including medical history, nutritional status, and condition of the immune system. Therefore, it is of utmost importance to discuss treatment options with a healthcare provider. If the infection is not treated, these symptoms may last for 6 weeks or more. Symptomatic infections are well recognized as causing lactose intolerance, which, while usually temporary, may become permanent. Giardia is not a new disease, although Giardia infections have only started being reported in the United States in the last 50 years with the discovery of the Giardia parasite. Anyone may become infected with Giardia. However, those at the greatest risk are travelers to countries where Giardia is common, people in child care settings, those who are in close contact with someone who has Giardia, people who swallow contaminated drinking water, backpackers or campers who drink untreated water from lakes or rivers, hence the layman term beaver fever, people who have contact with animals who have the disease, such as pets, and homosexual men. The risk of humans acquiring Giardia from dogs and cats is small. However, it can be done. Dogs and cats roll reservoirs in Giardia is not yet known. Children are at the greatest risk of contacting Giardia, especially children who live in developing countries. Giardia, however, is a global disease. It affects nearly 2% of adults and 6 to 8% of children in developed countries worldwide. Nearly 33% of people in developing countries, however, have had Giardia. In the United States, Giardia infection is the most common intestinal parasitic disease affecting humans.
Thanks for watching my informational video on Giardia. Hopefully I get an A on my project.